From B to B, all the people should stand here. Different cultures, nothing into the pot. Stop, walk, talk to your brother man. Communicate, I know you can.
How many people in the United States need organs? What determines who gets the donated organ?
Why is it so hard to get a donor?
Are there any side effects after receiving an organ transplant?
How can I donate my organs?
How do you match donors and recipients?
As you have probably guessed, there are many questions about organ and tissue transplants, but there are no great mysteries.
Hi, I'm Dr. Rafael Mendez. I'm a transplant surgeon and urologist. I perform primarily kidney transplants with a team of other surgeons, along with my twin brother. Hi, I'm Dr. Robert Mendez. I'm a transplant surgeon, and it's really a pleasure to be able to talk with you today about the things that we're doing in medicine, especially in transplantation. We work together commonly. We have for 27 years doing kidney transplants. It's like a dance. We don't have to talk to one another. We just move with 4 hands simultaneously. A lot of people want to know just what is transplantation and what does it encompass. Well, transplantation is really the giving of an organ, a life-saving organ, from one human being to another. That human being may have died tragically in some sort of accident and their organs retrieved, or they could be a living individual who is giving an organ to a relative or a very close friend. I was thinking how nice it was that you have volunteered to give your kidney to me or any other organs that I may need to have, because since he is my twin brother, I kind of think of him as my extra parts.
Why do you need a transplant?
Hi, my name is Sarah Bagley. I'm 18 years old, and almost 3 years ago I had a double lung transplant. I was very sick when I was a baby. The doctors diagnosed me with cystic fibrosis when I was 11 months old. With cystic fibrosis, what that does is it makes your lungs not be able to breathe very well. So I was suffocating to death. My lungs couldn't hold very much air, like yours can.
I had been given a death sentence when I was told that I had developed dilated cardiomyopathy, that my heart was enlarging, and that it would only be a matter of time before I died.
I was diagnosed with the liver disease when I was 8 years old. And I lived a childhood that I pretty much knew I would eventually need a liver transplant. But back in 1983, they were still very experimental. So I lived a life kind of figuring I'd die very young.
There are, unfortunately, some congenital illnesses that we are born with that do eventually cause an organ failure.
My name is Greg Mannion, and I had a heart transplant 3 years ago. I was born with a valve problem. It made this little whoosh noise. You could hear it. You could hear it close to my heart. You could hear it just going whoosh, whoosh, and you could kind of see it pulsating in my neck a little bit. I lived a normal kid's life. I played soccer and baseball and all those things. And I didn't have a problem again until I was 29, at which time I got a bacterial infection. Some kind of bacteria got in my body, and it lodged itself in the heart tissue.
Many of the causes of kidney failure and heart failure start with infections, throat infections, severe colds that are believed to be colds, but they are really bacterial infections.
What determines who gets the donated organ?
Whenever there's a patient who is a potential organ donor or an organ donor, there is a list that is run to determine which patients will receive the organs from that donor. The patients that are on the list are patients from all across the country. Every person that is waiting for an organ or a transplant is on that national waiting list. And that list is maintained by an organization called United Network for Organ Sharing.
They identify the blood type, the size, weight, and other medical criteria based upon what the transplant surgeons tell them. And when we have a donor who matches those criteria, their name comes up on a match list.
The sickest patients are at the top of the list, And also, how long the person has been waiting is also a factor in where they will show up on the list. All organs that are transplanted are tested to make sure that the patient is not going to reject them, because the human body recognizes anything that is not of itself, and it immediately would start to fight that off as a foreign element. We have antibodies that are produced that would go and attack anything in the body that's foreign, and it would recognize these transplanted organs as something foreign. So what labs are run are to test how well this new organ would last in the person's body. Because of the success of transplantation, many patients are added to the list every day. And at this point, the number of patients waiting for transplant far exceeds the number of available donors and the number of available organs.
Many people wait, in fact, 5 or 6 years or more for transplant. And of course, some don't make it.
Every day, patients die waiting for organs, because at this point, there's simply not enough families that choose the life-saving option of organ donation.
How long do recipients have to wait to receive an organ?
They said the average wait is about a year, and they said, so be patient.
And during those 19 months that I waited, I was very sick.
So I'm waiting home with a pager. If something comes up, then my pager would go off and I would immediately go to the hospital.
They call it beeped, and that means they get a hold of you with a beeper, and they tell you that way that your lungs are in.
The months prior to my transplant, I was in the hospital around, I would say 35 times with different ailments back and forth of end-stage liver disease. So it was very difficult.
While I was waiting at home, I couldn't do much. I made it a point to get up and try and walk every day, even if it was just walk down to the end of the driveway and pick up the mail and come back.
Before I got my new lungs, I wasn't even able to go up a flight of stairs.
I remember one time trying to make a peanut butter sandwich. I couldn't even do that in one step.
I'd go up the stairs, I'd have to take a break, and I'd cough, and I'd catch my breath, and then I'd finish, and I'd cough some more.
I had to go to the kitchen and get the peanut butter outside on the counter, and then I'd go lie down. And then I had to come back and get out the bread and lie it down, and then go lie down.
It was a big hassle when I had to do it at school because all of my classrooms were upstairs.
By the time I'd made the sandwich, I was too tired to eat it, and so I had to take a break, rest.
What is the rejection rate of organs?
We know almost immediately after implanting the organ that the organ looks good, begins to function, and will most likely be a successful transplant. However, within the first 7 to 14 days, a rejection response occurs in about 1/3 to 40% of patients. Similarly, our tissues in our body all have specific characteristics that we inherit from our parents. And so the closer a match of tissue you can get between two human beings, and we are all remarkably similar, the better the take of that transplant.
One of the most fascinating things about studying transplantation is to learn about your immune system. We have soldiers or certain types of lymphocytes in our body that are constantly circulating that will identify anything foreign within our body. The lymphocyte will go back to the lymph nodes and instruct the lymph nodes to make antibodies. The antibodies then leave the lymph node and go to the foreign tissue and try to destroy it.
At this point, the physicians must determine which medicines, which are known as immunosuppressive agents, that they will use to keep the body from rejecting this organ. And they will also determine not only how much of this particular agents to use, but also what combination they will need to use. And these patients will need to take this medication for the rest of their lives in order to maintain the organ.
How much does your life change after a transplant?
Hours after, 8 hours after surgery, and I was sitting up talking 100 miles an hour. I was hitting on the nurse and flirting. And
Around 3 o'clock in the morning when I heard voices, and there was the voices of my parents telling me to open my eyes. It was a feeling of, first, oh my goodness, I survived this.
After my transplant, during PE, our teacher, Mrs. Kreipel, said that, okay, today we're going to run up the stairs, and that's it.
At the rehab program, they said to me, they said, Greg, well, is there something that you like to do, is there something you want to do? And I said, yeah, I used to swim laps when I was in college, and I want to swim again.
So we had to run up the stairs and down the stairs, and up the stairs and down the stairs, as many times as possible. And I think I did that about 12 times.
I took it as a challenge or something, and I got in the pool, and I swam 30 laps without stopping.
I'm grateful that the donor family made the decision to donate because it allowed me to go back to work as a sailing instructor, which I love.
I really don't have any limitations right now. It's amazing. People, they don't even know that I've had a transplant. They look at me and if I tell them that I had a transplant, their eyes open wide and say, you're kidding me.
Gotta get a good feeling.
15 months after my heart transplant to the date, I competed in my first of 3 New York City marathons.
Okay, I knew how to swim previously. I mean, it wasn't like I never knew how to swim before. And we took this heart from an Olympic champion and put it in Greg Manion, and now he knows how to swim. He used to be afraid of the water.
What organs and tissues can be donated?
Currently, the state-of-the-art allows for transplantation in the solid organs of heart, lung,
kidneys, pancreas, and even the small intestines are needed for life-saving transplants.
Tissue donation consists of donating corneas, and this can go to help blind people see, and skin, and the skin is donated and used for people who have been burnt, and also bones and associated soft tissue.
Sometimes blood vessels that are needed in surgical repair of major accidents, or sometimes to help someone else's heart transplant, for instance.
One of the important factors in organ transplantation is the freshness of the organ. It's very important to minimize the time that an organ is out of the body.
For as an organ is removed from an individual who has died, we have a very short period of time in which that organ stays viable, or if that organ continues to live.
So in the case of a kidney transplant, where a live family member or perhaps a wife or a husband is donating to a spouse, the procedures are carried out simultaneously in 2 different rooms. While one person is retrieving the organ, the other surgeon is opening the recipient and preparing the area where the organ will be placed.
Once the heart is recovered, it can last about 4 hours outside of the body, and the lungs also can last about 4 hours before they need to be transplanted. The liver can last up to 24 hours, but they like to transplant it within about 15 because that's been shown to be associated with a higher success rate. The kidneys can last up to 48 hours, and the pancreas up to 24 hours. But all of the organs, the sooner they transplant them, it's associated with a higher success rate.
The science of preservation and the study of organ preservation is at this time very intensely moving forward. For it not only affects transplantation, but the preservation of an organ really means the preservation of life. So as we come to understand why an organ starts to die, and we can prevent this, we can start to understand the aging process and how to prevent that.
Can anyone be a donor?
Anyone can be a donor from birth up to an undetermined age at this point. The oldest transplant that I've seen is from a person from the age of 83, so we don't know the upper limit. And the only absolute rule-outs to transplantation are someone who's HIV positive, someone who has cancer at the time of the donation, and someone who has a system-wide infection.
The majority of transplants done in the United States, especially the vital organs, the life-sustaining organs such as heart and liver, must come from cadaveric individuals.
Cadaveric donation means that the donor is dead. And usually the cause of death in these donors is some sort of head trauma, whether it's from an accident or from something internal like an artery or an aneurysm that is ruptured inside the brain and that has gone to lead to this patient becoming what we call brain dead.
Brain death is both a medical and a legal term. On a medical basis, it is this equivalent to cardiac death. That is, that when a heart stops, the person is legally and medically dead. And when the brain no longer functions, no longer has blood flow, the person is both medically and legally dead.
And it requires in the country the declaration of two independent physicians not associated with the transplant team and or a transplant center to certify that the patient is indeed brain dead.
Living organ donation has many very positive effects, not only on the recipient, but also on the donor.
This morning, for example, we transplanted a kidney from a daughter who was 23 years old, who donated her kidney to her father, who was in his early 50s, who had suffered permanent kidney failure and was on a kidney machine being dialyzed 3 days a week. Now, with this gift of a completely healthy young kidney, he will be able to go off dialysis and resume a completely normal life.
And it is very safe. We've done it here at this institution for over 25 years without any major or even minor problems with our donors. And thus, it is a tremendous gift of life to be able to restore the health of a person that you love.
How did you feel about the donation you made?
So I was going to a teacher's meeting to accept his Student of the Month award. And while I was sitting in the classroom discussing his future, I heard sirens while I was sitting in the classroom, and I looked at the clock and said, my son is waiting for me. We're going to celebrate his achievement. And I got out of the classroom, got in my car, went probably a half a block, and saw police and fire and whatnot. And I saw my son's bike parked at the pole, and I thought to myself, what is he doing outside? He's supposed to be upstairs playing video games. I saw a little baby laying in the street, and I thought to myself, it can't be him, it can't be him. And I kept looking for him because I saw his bike parked next to the stoplight. And I just pulled a little bit forward, and I saw my son laying in the street, dying. The two nurses that came in told me my son was brain dead. There's no activity, and they asked about the organ donation. 2 weeks before this horrible accident, he actually told his teacher about donating his organs. He was very kind, very generous. I'm sure most people say that about their children, but yeah, he wouldn't want it any other way. If I didn't do it, I wouldn't feel good about it, because that was quite a topic of discussion with him.
Approximately 10 years ago, our 13-and-a-half-year-old daughter, Allison, was stricken with a blood vessel bursting in her head. It occurred very suddenly, with no previous warning, one night when she was sleeping.
Yeah, it was very difficult to accept the fact that she was brain dead. And you look to all sorts of different avenues for assistance and for something that might be positive coming out of something that's negative.
We had not talked about organ donation prior to that time. I had heard about it, I knew very little about it, but when we were approached in the hospital and asked, would you consider? It took very little time for us to make our decision.
My son passed away Memorial Weekend. He was 5 years old. I feel like donating his organs was a positive thing. My son was a very giving little child, and he gave to a lot of his friends, and he was known for that. And I figured that this is something he would agree to do if he was old enough to make that decision. I think he would have wanted it this way.
A little boy, 11 years old, my son's age, got his heart. He's in Canada. And 3 mothers received his liver, pancreas, kidneys, and all the intestinal parts.
When we received a letter indicating that individuals were living and thriving because of the organs that she had given, together we could look at each other and feel there is something there. We still are holding on to Allison. She's still part of our family and she's still out there.
And it's a neat feeling for the donor family and the recipient to know that the one is healthy, and even though the one is not, they have, in a sense, a new family member.
I think it's like adoption in a way. The family, the donor family, has an interest and wants to know what happened to the recipients. I think it's important to their healing process.
The most exciting thing to me is to see young students, not only in college but in high school and in junior high, asking such penetrating and excellent questions, and to know that amongst you in the audience is an individual or individuals who are going to help us really advance the science of transplantation.
Then that patient has to be available to get to the hospital very quickly. That patient must be in good health to be able to accept the organ. And the physicians who will do the heart transplant need to have as much information about the condition of the heart that they're going to transplant. And typically they will go to the donor hospital, recover the heart themselves, and carry it back to the transplant center.
How many people are on waiting lists for transplants?
There are thousands of people waiting, and every day people die who are on that transplant waiting list.
If more people were willing to consent to donate, then there'd be fewer people like me waiting for transplant.
It's very important for everyone to talk about it and see how they feel about it, and maybe if you wish to donate your organs, you know, to tell mom and dad.
Because you guys are the ones that are going to take this information and you're going to go home with it, and you're going to talk to the rest of your family about it, and you are the ones that are going to form these new ideas for the people around you.
And there are so many people that just wish if one more person would give up an organ when they died, that they could have a chance to live.
The decision to be an organ donor is a personal decision, and we hope that you will think about this and talk about it at home with your family and share your decision, and your family share their decision with you.